Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
all of the following are true about round ligament except. So, in round ligament measures 12 centimeters in length, whereas round ligament is homologous to the gubernaculum of testis. Round ligament lies anterior to the obturator artery along its course. So, round ligament does not contain smooth muscles.
It is just a ligament, so it does not contain smooth muscles.
Then, all of the following are true with respect to ligation of internal iliac artery except. So with respect to ligation of internal iliac artery for hemostasis, anterior division to be ligated. Yes, collateral circulation is established later between middle sacral and lateral sacral arteries. Bleeding is always controlled with it. No, artery should be ligated and transected. This is true. Bleeding is not always controlled with it. Actually only the anterior, because here the problem is in the internal iliac artery we have two branches, anterior branch and posterior branch. Only the anterior branch will supply the pelvic viscera but not the posterior branch. So we generally ligate only the anterior branch but not the posterior branch. The artery should not be transected also, remember that. Next.
thank you and thank you for watching.